Now, quickly look at another issue which affects the adrenal gland, and this is what is known as the congenital adrenal hyperplasia. Congenital adrenal hyperplasia. So, for the congenital adrenal hyperplasia, this is what we got. It just has to do with the adrenal gland, and the cells are increasing. Okay, so that's why I don't understand this image. I think hyperplasia should be getting larger. I think that should be a mistake from their side. You know, so it's actually a group. Okay, they are similar disease condition, but so there are disorders that usually what affect the adrenal glands, and it leads to what hormone imbalances. The most common one is the 21 hydroxylase deficiency. This one results into the cortisol and aldosterone that will be produced from the adrenal glands will be very small, but androgen will be so much. So cause is usually genetic mutations. So it's affecting the enzyme. Most commonly, we have the 21 hydroxylase enzyme being affected. So hormones affected include the cortisol hormone, the aldosterone, the androgen. So types, we have the classic one, which is usually detected at birth. We have the non-classic one. That one is later on in life they dictate it. So symptoms is you're having a big what if you're causing the females. Of course, androgens are not supposed to be too much in females. It should be estrogen. So you have high androgen, so it makes their genitals so big. If you're causing the males, the penis is too big for their age because of too much androgens. Also, adrenal crisis where they are vomiting, dehydration, low blood sugar, and shock, then rapid growth, and they hit puberty is too early. Okay, and they become adults and their height is short. Okay, so that's what we have. Later, you have irregular periods, infertility issues, and hirsutism. The hair on the body is too much. They have too much pimples too. Okay. So risks and complications. It could lead to adrenal crisis, which is life-threatening emergency. Electrolyte imbalance, where sodium is low, potassium is high. They are dehydrated. Fertility issues. Later on in life, when they want to conceive, they find it hard. Women are finding it hard to become pregnant. Men are finding it hard to impregnate their wife. And also psychosocial impact. You just see that you have a big genitalia and there's issues, right? So diagnosis is you screen for the newborn, genetic test to confirm all the enzymes are there, not mutated. Check for levels of cortisols and aldosterone and androgen to see if they are elevated or not. Then prenatal testings like amniocentesis and also chorionic villus sampling. Okay, if you feel like the parents are carriers and there's a risk of the child having the issue. Treatment, that's where you do use all those glucocorticoids like hydrocortisone, prednisone. Use mineral corticoids like all those fludrocortisones and salt supplements. Then, okay, surgery. If the genitalias are too big, you can do the surgeries. So that's the whole of congenital adrenal hyperplasia.